Good evening, everyone. My name is Martin Lockhart. I'm a member of the NAACP, and I wanted to discuss the healthcare inequalities that minorities have been facing. The goal is to eliminate healthcare discrimination. Healthcare disparities are an important public policy concern as they are related to social inequalities in the population health. What you may not know is health disparities don't only affect the person that is experiencing the issue, it affects the entire population within the society. Because of these health inequalities, the improvement of healthcare systems will be limited, and all healthcare services that are being provided will cause the government to spend large amounts of money. According to Cigna, the U.S. economy loses roughly $309 billion a year providing healthcare services. Health inequalities put everyone at risk of contracting a disease or illness. Because African Americans don't receive the same level of health care of other minorities, it puts them at higher risk of contracting life-threatening diseases. Because they don't have the money to pay large amounts of out-of-pocket expense, many African Americans try to avoid visiting the doctor. They should not have to choose between their livelihood and their health. This affects the entire community. Because if an outbreak occurs, it will cause the community to use all other resources allotted to them quite quickly. And most African American communities have little to no resources, so they have to travel outside of their community to other healthcare providers to get adequate amount of services. Most African Americans lack health insurance because insurance companies deny those who they think will cost them a lot of money. They do this so they can save that money and pocket it, which they should use that money to take care of the patients. The patient's health should be the main priority of the insurance companies. Most hospitals are built in areas where they believe will be more profitable, like any other business. This makes it harder for African Americans who usually live in low-income areas to receive healthcare services. Sometimes the hospital can be located 2 or 3 cities away, which can be a problem finding transportation back and forth from appointments and regular scheduled checkups for African Americans or minorities. According to a study published in Health Services Research, white males live 7 years longer than black males. White women live 5 years longer than black women. Overall, the health of minorities seems to be poorer than those who are more educated and financially stable. African Americans work in low-wage, high health risk occupations, which puts them more at risk. The federal and state government can step in and help eliminate discriminatory practices in health. Healthcare providers shouldn't see color when they are helping patients. They should be more concerned with preserving and saving lives of everyone. They should be unbiased when serving the people within a community. A good way they can eliminate healthcare inequalities is by hiring a more diverse staff of healthcare professionals that can relate to the patient, which will help develop a sense of trust. If the patients trust the doctor and the healthcare professionals serving them, then they will be able to discuss their healthcare issues. They'll be able to discuss what's going on with them and be able to be treated properly. Because they don't trust healthcare professionals, because they easily judge, and they don't want to be judged. They don't want to be looked at a certain way. So patients find it hard to discuss their health care issues with doctors or any healthcare professionals because they feel like they don't have the greatest insurance or they don't have the best medical doctor or the best health status or social economic status, that they will be looked at differently. Most African Americans don't trust healthcare professionals, so they tend to not go to the hospital to get regular checkups. Which we need to eliminate this issue because we all live within the same communities. If one of us gets sick, we all get sick. If we can eliminate these healthcare inequalities, then African Americans and other minorities will be able to easily go get regular checkups, go see the doctor like they're supposed to without being judged. We can work together to fix this issue by providing those who cannot afford to travel to hospitals shuttles to get back and forth from appointments. That way, we won't waste any money on missed appointments, and we won't have to worry about anyone canceling their appointments, because we need everyone to go and receive those health care services so that the community as a whole can remain healthy and live longer, happier lives. This will increase the likelihood of more minorities to actually make regular scheduled doctor visits. We need to work with insurance companies and inform them of how much money they are causing the government and how much suffering they are causing in these low-income communities. Because minorities cannot afford to shell out large amounts of money to receive adequate healthcare services, it causes them to not deal with the problems that they are facing, which we are all here to help. So we should inform them on how much money they are losing when they deny minorities of healthcare coverage. Everyone deserves to live a long, healthy life. When you deny people of healthcare coverage, you put the entire community at risk, including your children, your cousins, your nieces, your nephews, your mom, your dad. Would you want to deny them of healthcare coverage if they were very sick and couldn't afford adequate amount of healthcare services? Think about the future instead of the now. Another way we can fix this inadequate amount of healthcare services for minorities is providing mobile healthcare services, where healthcare professionals actually have a mobile van and they travel to the patient for appointments to avoid them from missing appointments or not getting the regular checkups or canceling appointments. Because we all have jobs, we all have responsibilities, but healthcare and making sure we are healthy and that we are lively and happy is a part of our job as well. Healthcare professionals should be trained on how to deal with the public regardless of their social status. We should all receive the same amount of healthcare services. This will keep all the community safe and healthy. We all live in some of the same community, so we should all receive the best healthcare services that we can. We need to break down these barriers, and we need to work together to give all of us equal amounts of healthcare. It shouldn't matter the color of your skin, your religion, your background. We should all be able to live happier, healthier lives. Many African Americans are more susceptible to contracting certain diseases. For example, tuberculosis and diabetes. So healthcare providers try to teach classes on how to monitor sugar intake. They try to give us ways that we can actually work on not intaking too much sugar that will push us to the edge where we will contract diabetes. We can also teach classes within these communities on how to remain healthy, how they can keep their bodies in shape, how they can work on their physical health to improve their mental health and their physical health. Working within these communities can save the government large amounts of money because because African Americans cannot afford adequate health care. There are large amounts of unpaid medical bills that taxpayers have to pick up because they can't afford to pay the medical bills, which is one of the reasons why we need to work together to come up with a system for everyone to get adequate amounts of healthcare services.